For this evening, the question is from Guillaume Fugère-Nadeau from Montreal, Healthcare.
At each electoral campaign on the federal level, there are promises such as emergency wards will be improved, or physicians will be helped. What are you going to do to help Canada in this field?
Mr. Stéphane Dion.
Thank you very much. You put your finger on the basic problem here. It's very simple. We don't have enough doctors or nurses. We've got less than the other developed countries, and the situation could get worse because the average age of our doctors is 50. There are a lot of nurses, doctors who are baby boomers, and they'll be retiring at the very time when the population is aging. So I'm worried about that, to see there are so many Canadians, 5 million, 2 million in Quebec, who don't have a family doctor. So what we are proposing is to have a federal fund, fully inconsistent with provincial jurisdiction, but to help the provinces to get more doctors, more nurses, train more. It's very important to do that, and it's the most crucial thing for the health of individual Canadians.
Elizabeth May, please.
As far as the Green Party is concerned, health means physical, mental, and social well-being. In order to achieve this, we have to protect Canada's public system. We do have a doctor shortage, a nursing shortage, and a bed shortage. We have to protect and implement a better system in mental health areas. We also have to increase funding in that area. And we have to prevent diseases caused by dangerous chemicals. We have to ban those chemicals which contribute to cancer.
I think health is Quebec's jurisdiction and provincial jurisdiction. Let's be clear. Quebec provides the services. That means we need to stop federal intrusions like Mr. Harper's done, and this was criticized by the former Quebec Health Minister, Mr. Couillard. If we respect one another's jurisdictions, then that means Quebec should have the right to opt out with full compensation. That's precisely what we need. Now, taking care of health, if the federal government would mind its own business and inspect food and provide affordable housing, there's a lack of affordable housing, and that has repercussions for health. And if we gave seniors what they deserve, Mr. Harper promised to give seniors their retroactive GIS, and he didn't do it.
We've had decades of shortages, not enough doctors, and now we're facing a crisis. 5 million Canadians do not have 5 million Canadians do not have their own family doctor, and that's terrible. If you don't have a family doctor, that causes all kinds of problems. So we have suggested training more than 20,000 more doctors and 6,000 more nurses each year, working with the provinces, and asymmetrical federalism is a principle for us. We have to make sure that we do this training so people can have their own doctors.
Mr. Harper.
It's important to recognize, first of all, that the healthcare system is managed by the provinces, and we have to work with the provinces. That's what we've done. That's what we've done with all of the provinces, by fixing the fiscal imbalance. We've provided funds to the provinces for health. We've increased them by 6% this year. We've signed agreements to establish projects for waiting times, and we've also mentioned mental health. We established a National Commission on Mental Health. We've provided funding for this commission to deal with the issue of social housing. We've responded to the problem of chemicals. We have created regulations.
Mr. Harper, yes, Mr. Layton.
Well, what I'm asking Mr. Harper is, if you are giving these big gifts to the big corporations, $50 million, nothing will be left over to train the doctors and the nurses that we need. So it's about making choices. You made your own choice. You chose tax cuts for banks rather than investing in training of doctors. Why?
I lowered taxes for the Canadian economy by $200 million, one quarter for corporate taxes. I did this to ensure the stability of the Canadian economy throughout this crisis. And now we're continuing to create jobs. We still have a surplus, a budget surplus. We have a financial system that is still stable. There's been no bankruptcies among our banks.
Let me just repeat something.
It's important. We've provided a lot of funding for health, but
where are the doctors? Where are the family doctors?
The stability of Canada's economy.
Thank you. Mr. Giuseppe, you wanted to add something?
Mr. Harper says he settled the fiscal imbalance, but there's a consensus in Quebec. Mr. Charest says that's not true. Mr. Dumont says it's not true. Ms. Marois says it's not true. The Séguin Commission says it's not true because it hasn't been settled. It hasn't been fixed. Major steps have been taken financially, but there's been no transfer of tax points like Lesage did with Pierce.